Hey everyone, my name is Dr. Tan, your survival doctor, and today we're going to be talking about everything related to wounds, how to identify it, how to prevent it, and how to treat it. So my goal for today is to make sure that you go to the ER one less time this year for wounds that you may experience on your everyday living, or if you're out in the wilderness. So with that, let me know what questions you have, and we'll start our session right now. So, welcome everyone. Welcome to our students who are coming here. They have the back row seats, so they have a separate private chat, but you guys can comment live as well. I'll be keeping a close eye on the comments and answering your questions as they pop up. Things might be related to your own first aid kit. It might be related to things that you may have heard for wilderness remedies. Let me straighten out some facts for you, and also give you my 2 cents on whether those things would work or not. So there's a lot to review today, but let's go back to the basics. And so happy to see some familiar faces over here. Give me a shout out to where you're coming from, and I'll see if we can get you a special package for our giveaways because we are doing a giveaway webinar very shortly. End of May, early June. So we'll be sure to announce that in the near future. And if you haven't already, subscribe so you're getting these notifications when these giveaways are happening, because these are literally anywhere from a $40 tourniquet all the way up to like a $300 trauma pack. We reviewed one just last week and it was like 30 pounds. So really cool stuff. So subscribe and check out for the notifications on when these events are happening. So wound care. Wound care is something that I think no matter what you're doing or where you are in your journey to learn medical skills or just to play outdoors or just to be a prepared parent, it's something that you really need to know well. The majority of the cases that I see in the ER are kind of two situations. It's mostly people who get injured immediately, concerned that it may get infected, and two, actually three. The second one is people who come in a little too late and it gets really bad on the border of getting that infection, which starts in the skin, going into their blood system. And we'll talk about what that looks like in that transition period. And then third, lacerations. But lacerations we'll do as a separate topic because that is a pretty big topic that has a lot of improvised technique that you can use in the woods. So we'll leave that as a separate topic. But just to give you an example, like I was no different than you many years ago, just cutting myself, typically not wearing gloves and not wearing a whole lot of footwear as well. So I would get these puncture wounds and I would get these cuts from just practicing my bushcraft skills. And some of these nicks were pretty deep. Like I've stabbed myself in the thigh before. I've cut myself right in the ring finger. So there's actually a little bit of a scar right over here. Not sure if you can see it, but that was one of the scariest things. I think I was like 13 years old, and I was just cutting like an apple or a pear or something like that. And I remember using this new knife. It was one of those hook knives, and with those hook knives, it's just odd to manipulate. You know, it's a new knife, and I was just cutting again, not being aware of where that blade is kind of like having a rifle or a weapon. You don't want that nozzle or that sharp edge pointing to anywhere that you wouldn't want to cut. And I ended up slicing pretty deep. I thought it was almost a bone, almost a tendon, because how deep it was. I went completely white, and it was almost like a shock, not necessarily from the blood loss, but there was bleeding. But most scary was like, did I lose function and feeling to that finger? And I ended up putting direct pressure, washed it out pretty good. I think I just used soap and water way back when, and I didn't tell my parents. 100%, I didn't tell my parents because it was like their paring knife. And what I did was I ended up using super glue. And I know there's a lot of proponents out there who love super glue. And for certain wounds, like think about paper cuts, not too deep, not too long, it works okay. With super glue, though, there are chemicals in there that are not meant to touch your cells, so that can cause inflammation. And if it's a deep cut, like the cut that I had on my finger, that inflammation ended up turning into an infection. I was working at a lab trying to get some extra credit in school, and I remember wearing my gloved hands, and just like over time, it started to feel warm, more pounding in nature, kind of throbbing, and it started to look quite red around the area. And when your wound starts getting a little bit red, a little bit warm, a little bit swollen, and more painful, and if there's pus coming out, those are like telltale signs that you have a superficial skin infection. Now, we'll talk in a brief bit about skin infections, the different types and different layers, and also abscesses, which is two different things, and the treatment's actually two different things. It's not just antibiotics for everything. So that was where I kind of started with playing around with stuff. And as I noticed when I was going outdoors more, I typically packed things to sanitize. Like initially, it was those alcohol swabs and some hand sanitizers, which burns like heck, and actually reduces increases healing time. So it makes it longer to heal because it can irritate and hurt the cells, which is the case with a lot of sanitizing agents that are pretty powerful, like hydrogen peroxide, that can burn the wound, but also kill the bacteria. So it kills the bacteria, but it also kills your cells too, makes it longer for you to heal. So I do not recommend those, and we'll talk about things that I do recommend. So as a big overview, we're going to be talking about identification, which those were the telltale signs. We're going to be talking about preventions. We're going to be talking about sanitation options and wound cleaning options, and also early identifications. And should you do prophylactic antibiotics? Should you just preemptively do it? I'll talk about some situations where yes, and situations where it's a no. And then we'll kind of talk about some wild options as well, because there are some go-to things. Oh, my cousin's on. Hey, Wes. Awesome. So we'll be talking about that as well. And it's cool that we have some parents coming on board because this is something that I see a lot in kids in the ER. So it's very pertinent to if you have kids or if you just want to save yourself a visit, because at the end of the day, very realistically speaking, you're waiting at least 3 hours in the ER unless it's in the middle of the night. And typically, if it's not 3 hours, it's longer. And then the doc sees you for like a few seconds, if not minutes, and then sends you out the door for something that you could have treated yourself. So if I can save you that visit to give you a little more confidence in your diagnostic capabilities and to know when you should go to the hospital, that would be the goal for today. So number two is things that kind of prevent you from kind of doing things yourself. So a lot of the times, one of the concerns is, did I cut too deep? Is it infected yet? Those are some of the questions that I get. And mind you, we do at Survival Doctors teach people in person. So one of our last, I think it was 2 classes ago, we had a week-long course, and there was a student who was handling their axe. It was a brand new axe, beautiful grass firs axe, and I think it was like a forest axe. So if you haven't checked that out, check out the link at survivaldoctors.com/store, because there are some axe options over there, and it's just one axe that I personally would want, because it is very lightweight, nice pack weight, but incredibly sharp. Comes out of the box incredibly razor sharp. But anyways, he goes, and I forget what he was doing, but he ended up getting just the top of his kneecap, and I think he was just whittling something down, and it was again whittling between the legs, which is a no-no. You want to be whittling on the side of either thigh, just off to the side, so that you don't get anything really concerning. But he ended up getting a little nick. So I gave him 2 options. We could send him to the ER, which was really close. This was in Ontario. Or we could have stitched him up right there without any anesthetic, which is, again, not 100% necessary. And number 2, we could have treated it as a wound, because what happens when you get a wound that is deeper than your skin, that wound you can repair if it's greater than a centimeter. Centimeter is typically like 1 stitch or 1 staple. So if it's longer than that, you can stitch it if you would like to. But if you don't, what happens if it's cleaned properly, it tends to heal, and it has all these little materials that your body produces, kind of like scab tissue, and that slowly over time fills in that gap. The V kind of closes, 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 fills that gap with a bunch of different tissue, and then that scabs over and you get a wee bit of scars. So he opted for treating himself under our supervision with that wound. So you guys are all capable of doing this, especially if you're going on a trip on your own or a camping trip and you don't want to delay or preemptively end your trip and come home early for a minor wound. I'm going to Alaska in August myself, and we're packing pretty darn light. So my first aid kit is probably my trauma kit, which is like this big, and then my first aid kit, which is probably like this big. So for wound cleaning, that's one of the most important things to do. So all of you who've been longtime followers of this channel know that I love this guy. I love pressure washers, and I have this 50 ml, and it can go more than 50 mLs, probably like 60 or 65 mLs if you draw it all the way back, of pressure washes. And pressure washes, what it does is it removes a lot of the debris. So let's say dirt and whatnot, but also the bacteria. So you want to be reducing that bacterial load. Your body does have an innate ability to kill bacteria, viruses, and so forth. So if you give it only like one little bacteria to fight or one little issue to fight, it can be good at making sure that you don't end up with an infection. So it is 1 centimeter. So for every centimeter, you're doing 100 milliliters. So that's about 2 pushes of this, and that would clean it out fairly well. Other really good thing, I would prefer soap and water over a lot of different things. So non-scented soap and water. That's one of the things that I'm bringing. I'm just bringing like a non-scented bar when I'm going up in Alaska, and just removing that material, because you are literally how the soap works is it encapsulates the bacteria, it encapsulates the debris, and if you are then after pressure washing, it really gets everything and then washes it out. Now, one patient that I had just last week did an excellent job. He was working on his roof just after dark, and it was one of those metal roofs that were really slick. And like the last minute project where you're like, oh, I'm just gonna go up there to fix this one thing, always ends up with something like this. So he fell and he caught himself, but it's so slippy on those metal shingles that the thing that he caught himself was a nail that was just protruding up like that. And he just whacked him, stabbed it right there. And it ended up just ripping. Oh, we got another buddy on board. Hey, what's up, guys? Joel and Timber Woods, some old friends. Awesome. So this guy opens up his hand, and yes, he needed some stitches, but one of the things that he did do that was like fantastic, like when he came in, I literally didn't have to do much but just stitch him up and numb him up. But what happened is he ran it underwater. So it doesn't need to be sterile water. That's another thing. If you're in developed country with kind of adequate water supply and you're not having a bunch of bacteria and stuff like that, tap water is fine. You don't need to boil your water and use sterile water or use normal saline. Tap water, running it for 5 to 10 minutes is fine. So he did that. And then what I love that he did was he mixed iodine 50-50 with water. And then he flushed that again. So really that gives you such a clean wound. And then he came in. So if you are able to basically wash your hands, do a pressure wash either with this, you puncture a little hole in a squeeze bottle or in a Ziploc bag or a bag, and you just push water onto your wound. Or if you have kind of issues with using your hands, you can hang a bag really high and have that water drip on your wound from a high height, because that velocity and that impact will add some pressure to that wash. So if you're able to do that, just wash your wounds, you're pretty much on your way to lowering your chances of infection. So, but if you are, let's say, in a situation where you're coming from home, like my cousin, and he doesn't have iodine, he may not have some antiseptic stuff, there are solutions that you can make. So iodine's pretty cheap and pretty affordable. You can go to the department store, corner store, and get that pretty easy. But something that's even more accessible is bleach. So non-scented bleach is a pretty good antiseptic, and you can use it for water purification. So if you're interested in water purification methods, including saltwater stuff, distilling, and all sorts of the crazy things, subscribe to this channel and also check out our free lessons. So what I'm doing now is doing 4 live lessons a month, and also recording a lot of these and editing them out and having exclusive lessons to our students as well. So if you aren't already on board, check it out. You get 30 days for free. You probably learned more than a handful of things that could save your life and could prevent you from coming to the ER, to be honest. So if you want to do that and learn stuff that you can apply almost immediately, just check out the link in the descriptions. But if you want to make your own antiseptic solution, there was a man named Mr. Dankin. I think I'm pronouncing it right. If I'm not, I'm sorry to his heirs. But Dankin, that's Dakins. So Dankin solution. So bacteria, just like our bodies, we have a level of acidity and also electrolytes, but we'll talk about acidity first, and base levels that make our cells work properly. And outside of that range, you get into issues. So with us, you can kind of be unconscious if your acid levels are really high or really low, and bacteria is no different. They like their homeostasis. So if it's a very acidic solution or a very basic solution, bacteria have trouble growing. So Dankin solution is one end of the spectrum. It is a basic solution. And I'm just going to read off some of the things that are included in this. So we mentioned bleach. So bleach is just regular non-scented bleach, 0.4 to 0.5% bleach. And you're basically having your bleach. You have some baking powder or baking soda. So those are things that are readily accessible at the grocery store and something that you can stock up right now. And the one thing that I would encourage is you got to dilute this stuff, because one of the things that is kind of a no-no for a lot of these antiseptics is irritation. So whether it's an alcohol, whether it's um, blanking on the word, but peroxide, hydrogen peroxide, whether it's any of those things, it does kill bacteria, but it does damage your skin. So even with the Dankin solution, if you just put bleach on it, yes, it will kill the things, but it will also prevent your skin from healing really quickly. So you want to dilute the Dankin solution. So I believe it is 1/4 strength of the Dankin solution. So there's different versions, some for sanitizing tools and some for wound cleaning. So wound washes. So if you're at home, you can make this solution. In the wilderness, or if you have a shed, you can still do the same thing. What you would want is 4 cups of water. So put that, bring it to a boil. And once it's to a boil, you can shut that off, add half a teaspoon of baking soda into the water, mix it so everything's kind of dissolved, and then 24 mLs of your 0.4 to 0.5% bleach. So that's similar to 1 tablespoon and 2 teaspoons of bleach. And then you're mixing that all together. From the formulations that I've seen online, you want this to be in a covered container. So some people recommend that you're covering the whole thing with like aluminum foil, so there's no light in it. I imagine there's some degradation of the active agents there with light, so I assume that's why they're doing it. So if you're not using it within 48 hours, you're gonna have to redo it and toss it. But that's the Dankin solution, and again, this is a basic solution that helps. So how about if you don't have any of that? That's another thing. So we talked about identifying some of the key factors of being suspicious of when a wound gets infected, with all those signs of redness, puffiness like swelling, pain, pus, and the area of redness. One of the best things that you can do for yourself and for your doctor is take a Sharpie. This is just a pen, and you're basically drawing around that area of redness. If it is extending despite your wound clearing and maybe some topical antibiotics, which is just antibiotic ointments, then you're having a deeper skin infection. So if you are seeing that, you likely need antibiotics. But when should you have antibiotics? So that's another thing. So depends on, did you wash it really well, and depends on where and your environment. So oftentimes, let's say when I was in East Africa, I basically traded my boots, which was not, in retrospect, not the greatest idea, for a bunch of stuff. So I got some pretty awesome stuff. I got um, a shuka, which is like material that you can wear. I got like this awesome beaded belt. I got some sandals, which I later switched out to car tire sandals, which I'll tell you why. And I think I got a machete and like a spear for all that for like my boots, which were already worn out from the army. And the moment I got into these cheap, like dollar store sandals, they had like these little Death Star and also these acacia trees in East Africa. And those things like just puncture through like any kind of typical running shoe. And it just went right into my foot. And I would get these all the times. And the thing is, we were tarp tenting for the majority of the research project, and you would like grab under your tent to move it, and just all these little Death Star spiky things would cut your hands open. So there was a lot of wounds there. So what do you do in those situations where you don't have a whole lot and you're there for an extended amount of time? So I was out there for I think about 5 months, and then stayed another month or so, and I had a little bit of polysporin with me. So polysporin is a mix of like antifungals and antimicrobial stuff. And if you've used it before, you can continue to use it. But if it's your first time, especially if you're using it on kids, it can have an allergic component. So that's why I a lot of pediatricians, a lot of skin doctors actually recommend that you start with just like bacitracin, which is one just topical antibiotic. And you typically would want it if it's a very dirty wound. So think about like swampy, possible muddy stuff on the feet or in your shoe. So on my feet, since I was walking in it, I was sweaty in it. And when we're walking in the sub-Saharan Africa, there's like a bunch of different feces from all sorts of animals. So definitely covering that bandage up, and then also using topical antibiotics. But a lot of the wounds that I get on my skin, on my hands, on my forearms, after washing it and maybe covering it for a few days, it scabs over. And if there's no signs of infections, then great. So topical antibiotics can be helpful, but eventually you run out. I carry these little tiny packets, and if it's more than a few weeks, then you typically run out. So there are other things that you can do in the wilderness to mimic some of the things that we have commercially. And there are a lot of herbal things out there that claim to have antimicrobial effects. But hey Gary, but the issue with that is the research for a lot of these herbal medications, herbal recommendations are not really robust. A lot of these are passed on verbally or through written kind of scriptures, and there's not a whole lot of studies. That being said, the science of what makes a bacteria unlikely to grow is still there. So at the very basic level, soaps, acids, bases. So you can rest assured that a lot of the wound care things that you're doing in those kind of realms of medicinal kind of vegetation that you're gathering will still work. So to give you an example, if you don't have soap, and we weren't allowed bringing soap on Alone Season 9 unless you listed it as an actual item, which for some people might have been a good choice given how much people left my season for upset stomach and giardia. But so you can make soap, and to define soap, because there's a lot of different types of people making soaps that aren't actually soaps. So soaps, a base, a fatty acid, and then water. You mix that together, it will suds up, and then that will encapsulate the bacteria, encapsulate the debris, and release it. So to make that in a primitive setting, you have to have some fats. So if you're able to catch something that has fat dripping, which if you have something really, really big, like either a big game, a medium game, a beaver, then and you can kind of use that extra fat, then sure, you should, in all honestly, be boiling a lot of your stuff just so that all the nutrients are still in the pot and not dripping into your fire. But if you are using some of that, or if you're rendering down your fat and you get that clear stuff, you mix that in with white ash. White ash is your base. So it's not the charcoal stuff, it's not the black stuff, it's the white ash. And to be more powerful on that, you can also use different types of trees to get a higher concentration of base. We see that a lot in tanning hides. People using hardwoods. So think about your oaks, your maples, and so forth. Those would be a lot better than pines, hemlock, and that type of thing with the concentration. And you'll notice that if you're tanning something, it's the base is so much stronger that you're using buckets more of the softwood ashes than you're doing hardwoods. So in the same aspect, you can use that with your fats, which is fatty acids, and then mix it with water, and then you'll get soaps. What I did, because I have really greasy hair, is I was just putting a little bit of white ash in my hair and like scalp rubbing. And what that did was it made that same kind of reaction to make a soap. And when I was washing my hair, it felt like I had a clean shower. So that's a way to do it with a very mild soap. But you don't, if you are noticing some itchiness, some redness with it, you're using too much base. So that needs to be diluted down a bit. So that's base and making soaps. But another two things that you can very, very reliably use in, let's say, the boreal forest, North America, is things that have tannins in it and acids. So tannins are things that you can find on the inner bark. So think about things that if you boil them or dry them out, they turn kind of red and they kind of look like tea. So to give you an example, oak's one of them. And acorns, you can use the caps and also the nut shell as well. And a lot of inner bark. When you are chopping it down, the smaller bit you do, it's kind of like just making tea leaves. You're putting that, boiling it, and then letting it cool, and that liquid should get more and more dark. Darker it is, the more tannin concentrated it is. And you can test to see what is a tannin because typically they are classified as astringents. And what they do is they almost like suck in moisture or make your proteins kind of suck in. So if you put it in your mouth, you'll almost notice like a puckering sensation. So another one is the walnut. Have you ever seen a walnut? Let me know if you've ever seen like a walnut fruit. Typically like a yellowish bulb, and if you open up, it's kind of yellow. It stains your hands, and if you put a little bit in your mouth, it'll kind of like pucker and taste really bitter. But bitter is not the same thing as astringent. Astringent will have that puckering effect. So as you're making that solution, that you can use to wash your wounds daily and then replace the bandage. And with your bandage, cotton works really well. So you can cut up little cotton strips from your t-shirt or whatnot, boil it, dry it, and then use it to replace the bandage. So if you're replacing your bandage multiple times a day, then the likelihood of bacteria building up in that wound is a lot lower. So tannins one way to go. Another way is acids. With acids, one of the things that I used was lichen. So lichen, specifically reindeer moss, because reindeer moss is something that I ate on Alone Season 9 that nourished me. You can make porridges out of it. But if you eat it just raw, that acid, what it does is it can go into your stomach, which is a highly acidic environment. And because it's a weaker acid, it precipitates out, it makes little crystals. And those crystals can just shred up your stomach. Hunters in, I think it's in Scandinavia, Norway, Norwegian kind of area, that use that to hunt wolves. What they would do is they would put it in carcasses or stomachs of animals that they kind of hunted or killed, leave them out, and then the wolves would take it, eat it, and then have these crystals rip up their insides. And then those hunters would be able to eat the wolves, also protect their herd, and also get some pelts as well. So that has some acidity to it. And what I was doing on Alone was I was taking that water and either putting it on my shelter to make it an ice shelter. But number two, I had like a little bowl that I kept some of those acidic washings. And as that bowl kind of slowly evaporated, the concentration got more and more concentrated to an acid. And I would do my hand washes there. So that's another way to use an element of plants to make antiseptic agents in the wilderness. But there are other things. Pine pitch is one thing that is used quite commonly. So pine pitch, if you look at a pine tree or if you look like at a Christmas tree looking thing and it has some like gooey clear stuff, you can use it on wounds after it's cleared. And what it's doing is it's creating a barrier to the wounds. And similar to other things that you can use, there's a bunch of different salves. But the thing that helps healing is typically that moist environment. And if you look at the studies from like 2000s onwards and looking at different types of things like silver versus like Vaseline versus topical antibiotics versus all these different things, like even honey, the one thing that is helpful amongst like all of them, when what they have in common is that moisture barrier. So even if it's not antimicrobial, the healing time, if the wound is clean with just Vaseline that has zero kind of antibiotics in it, is fast. So think about on the scale of like 3 to 5 days, you typically start scabbing over. Um, oh, Mackie wants to come up. So, um, other things that you can use for natural things that you might have in your hamper, honey. So, honey and medical honey is not the same thing. The main difference is the allergens in it. So, medical honey is put through a very thorough process that that limits its reaction to, let's say, if you have allergies to a particular thing, because if your bees are taking flowers locally, then this is Maggie, then you can have allergies to those. But medical honey is specifically made for that. And how it works, it does, depending on where you're getting it from. Some have antimicrobial effects, anti-inflammatory effects. But one of the main thing is it sucks the water out of cells. Kind of like if you've ever done like an osmosis type of thing in science class, it when there's a concentrated something over here, the water typically follows and tries to go to that side. So the cells get dehydrated and the bacteria cells die. So another things that you can use that's wilderness slash things that you might find in your cabinet or your yard. Yarrow's a pretty good one. Yarrow, I typically use, I have it a bunch in my front lawn. You can use it for bleeding. So there's very small evidence. Again, I would probably use direct pressure over like spending time to make a paste out of yarrow to stop a bleed or to stop a very minor bleed. So this is not for a massive hemorrhage, and it also has some pain alleviation. So if it's a really painful cut, that you can use that. Fevers, kind of colds, and toothaches. Toothaches is a really good one to use yarrow for because you just put it in your mouth and start chewing it. So that's some of the things that you can use for wounds. If you use anything else, or if there's anything on the medicinal plant side that you like using, let me know in the comments because I know there's a bunch out there. I probably missed some, but neem is another one, but it's not like local to here. And yeah, those are some things about wounds. We have some questions or comments over here. Let me go through a few to catch up. I have a couple paper cuts and spent the last few days doing soil textures. Am I at risk for tetanus? So technically, yes. So the question is, if you have a cut and you're exposed to soil, does that increase your risk of tetanus? 100%. Tetanus it's a bacteria that is found in soil. So it's found in soil, can be typically associated with like metal cuts and that type of thing. We typically think barbed wire type of deal. But be up to date with your tetanus shot. It's every 10 years, so you have a big window. And if it's a very dirty, nasty, gross wound when you get it, we would like you to have it every like 5 years. So if it's 5 years since your last one, we would update you in the emergency department. Tetanus is a very nasty thing to get because you can't really tell at the beginning whether you have tetanus or not. It takes a few days to weeks to inoculate, and then it can affect you systemically. Like your system shuts down and you get really, really spastic. If you have a high risk tetanus and you're having some of those local kind of spasms, you do get injections for immune globulin, you get immunized, you get antibiotics, the whole 9 yards. So if you develop those, please see the doctor. So next question, the coffee enthusiast. Does polysporin increase your healing time a discernible amount, or is it just soap and water as good? So I would say think about healing time as like if you're healing within 3 to 4 days, that's like really good. And polysporin, it's more so the healing environment. So if you wash it out well and you can use Vaseline, it will heal very similar time to like a clinical insignificant time. So if you get like half a day sooner that you scab, it's not really going to change much. Why do scabs get itchy? It's almost like it's process telling you that it's ready to come off, but try to fight your urge to rip them off, because if you are ripping them off and kind of ripping that skin, again, that's an open wound, sets you up for infection as well. Timberwoods, thank you, brother. Appreciate the support. And Gary, miss you guys. I'm excited for your adventure in the Great North on that canoe trip. We are doing expeditions this year as well. I am doing one in Alaska, and we are hoping to launch one in Yellowstone on horseback. So that's going to be awesome. It's going to be a trip of a lifetime for me because I love horseback riding. It makes me feel like a cowboy. And the second one is going to be with none other than Jessie Krebs from Alone Season 9. She's also a SEER instructor, and we're doing cold weather survival and cold weather medical injuries in Colorado in February. So if you're interested in that, say yes to Colorado or yes to Yellowstone below, and we'll get you on the list. But with that, again, thank you guys for giving me ideas on what to do. This is 100% guided on what you wanted. So last time we took a poll for wounds, bites, burns, and I think there was one other. So you guys voted, and our students voted for wounds. There was a lot of interest in bug bites and burns as well. So let me know burns or bug bites for next week, and we'll get that information out to you. And again, if you want to learn this stuff, there is so much information. I think we have at least like 20 hours of information on our site. So check it out at www.survivenow.online/lifeline. And again, it's pretty much a one-man show. I'm trying to fix everything as I'm doing and give you guys the best content and information. So give me feedback. If it sucks, it sucks. Just let me know and let's fix it. Tea tree oil. Yes, tea tree oil has some effects similar to aloe vera, similar aloes. There's, I forget which, there's a species of aloe that has not only effects for burns, but also for antimicrobials. I've seen tea tree oil used for infections as well. But again, I would have to double check to see if there was actual research and not just word of mouth type of deal. But yeah, I'll put it in the comments, Gary, about tea tree oil to see if there's any good research about that. There's one organization. I'll reach out to one of my buddies who does a lot of she's a doc who does a lot of alternative medicine, and there's a society out there, like a big group that does peer-reviewed testing and reviews of articles and research related to plant-based medicine. And what's cool is they actually look at doses, because that's another big thing. If you have issues with doses, or there will likely be issues with doses because you don't know how much, especially for like an antibiotic. For pain, it's like as much as, until you don't feel the pain, and hopefully it doesn't make your stomach feel ill. But for antibiotics, it's like, how much is enough? Are you sprinkling some, chewing some, and then making a poultice? Is that enough? And the problem with those studies is they're not comparing it to, let's say, like a Vaseline versus like a Yarrow kind of poultice. So that's the issue there. All right. Thanks, coffee enthusiasts. Appreciate the support. With that, do you guys have any questions about anything related to medicine, related to survival? We are coming up to Alone season 11, and I'm super excited because, yeah, the crew this year looks pretty awesome. And they're up in the Arctic Circle, which means the hunting regulations are going to be a little more lax, which means that they have the opportunity to pick up some big game and a large variation of game as well. Awesome. Favorite memory in Colorado Rockies hunting, just me and a horse. That seems like the ideal thing. Um, our guy from Alone season 10 is going to be guiding us. So yeah, like that seems like such a fun thing to do. Springs hurt rather than help. Okay, we have a question over here. If you don't have any drinking water, just stream or running water with that syringe hurt rather than help. So if it's not tap water that's kind of like chemically treated, you would want to treat it. So you just need to bring it to a rolling boil, or if you want to treat it with your water, because if it's not a massive bleed, you have time. So you can drop in your swab, your little water tablets. You can filter your water and then use it in the syringe, but you don't want to do it directly from the stream because there can be a lot of different things, and that brings up the idea of waterborne pathogens. So if you are in a tropical environment, if you are in a sea environment, the bacteria that you get and the antibiotics that you get um, are different. So you got to be mindful of that. And if you want antibiotics, check out Duration Health. I'll put the link in my description. But you can basically get antibiotics. You talk to a doc in, I think it's only in the US right now, but you can talk to a doc. They'll prescribe you medications for your expedition, and then you have medications for what you need. Like my meds from Alaska. I'm doing. I have a bunch of antibiotics. I have things for altitude sickness, things for pain, things for inflammation, and all sorts of other stuff in between. Because I have a known ankle injury, and I know that ankle is going to be a little bit lax, so I'm taping it. But I imagine there's going to be some pain out there too. Um, so Steve Sawyer suggesting covering pressure points for using a tourniquet if necessary. So yeah, we can definitely talk about stop the bleed stuff. If you guys are interested in learning how to stop a massive bleed, this is someone that's going to die in literally minutes. There's already recorded stuff on our members site, so definitely check that out. Pressure points work really well with old people, pets, and kids. For like, let's say bigger adults, it's harder, especially if they have thick legs and it's a leg bleeds. So I would much rather you just put on a tourniquet than put a pressure point or direct pressure. So there are some evidence saying pressure points are a good thing, but it's been going back and forth over the past few years, so it's not something that's widely recommended. Ooh, so one of our students, Michael, mentioned, "Can you comment on doing whole blood transfusions in the field?" So we're getting some high level stuff. So when should you do whole blood transfusions in the field? So when we're thinking about transfusions, you're thinking about, okay, you don't know the person's blood type unless it's a military setting and they already have kind of confirmed that they're a certain blood type, and you have a blood bag that you can give them. Whole blood, just for those viewers who are not familiar, means that there's everything that's in blood is in that package, because sometimes we just give one component like red blood cells or platelets or clotting factors. But whole blood in the field for, let's say, a massive bleed, the person doesn't have a pulse because they're bleeding up so much. Yes, that would be a good time to do that. You can also consider some tranexamic acid. The evidence for tranexamic acid is decreasing as more and more research is coming out. But right now, for trauma related stuff, still give it. And it's you can inject that in through the IV. I believe you can do it IM as well, and you can start those transfusions. But that would be in a shock type of situation with a known source of a massive bleed, but not for a minor wound. What's interesting is there are some countries that use artificial blood, so that can be stored at room temperature for months and months and months, and blood type does not matter. Just put that in. I'm not sure if they're still using it, but yeah, one of the researchers at McGill was um, was one of the inventors. Awesome, guys. Thank you for the engagement. Thank you for the questions. Thank you for the ideas. Very, very grateful to have you guys. And if you have not subscribed to the YouTube channel yet, please do. We're doing this pretty much every week if I can help it. And yeah, tell your friends. All right. Take care, guys.